Hi everybody, welcome to my talk today. How do I choose my nursing dissertation topic? The reason I've chosen this is because I spoke to some second years a few weeks ago and I promised them I would do this session for them. And the tips today will also link to formulating your research or review question. And I'm aware that some of you may be doing a research study or service improvement project. It could be a proposal, it could be a literature review, and the majority of you are probably doing a literature review. So the tips will help all of you. If you find it helpful, do let me know in the comments. Do subscribe to my YouTube channel with lots of free videos for nursing career and development, and I've got lots more videos coming out over the next year. First thing I thought I'd go over is you will firstly start with a general topic area and it'll start to be narrowed down. So I've got an example topic area, an example aim or purpose for a study or literature review, and an example research question. And sometimes studies have got 2 research questions, which is fine. What I would probably start with here is my area of interest might be newly registered nurses and what happens to them when they first register, because you're going to be a newly registered nurse. And you could potentially look at the literature from the perspective of the employer or nurses working with newly registered nurses or the newly registered nurses themselves. So when you've got a general topic area, it'll need narrowing down, but it's great if you can start with just thinking about those general areas that you're interested in. So here I've started to narrow down, and my topic area is going to be an examination of newly registered nurses' experiences during their first year as a registered nurse in UK hospitals. Now it could just be in the United Kingdom, it could be just in community settings. It just is dependent on the literature. I haven't gone and looked at the literature at all, these are just made up, but it can be tweaked. The topic area is not set in stone at the beginning, and that's where you're going to use your supervisors for advice. The aim or purpose of this study or literature review is to examine the experiences of newly registered nurses in UK hospitals during their first year registered to inform the future support of newly registered nurses. So if I was writing a research proposal, if I was going to examine the experiences of newly registered nurses, I might interview them or I might send a questionnaire. I would have to think about my sample. If I was looking at a literature review, I'd look at all the literature that has examined newly registered nurses' experiences, and there might be questionnaires, there might be national project work, there could be a variety. I have no idea what's out there in this area currently. Research question: what are the experiences of newly registered nurses in UK hospitals during their first year registered? So I hope those examples are helpful. So when you're firstly looking at your topic area, you need to think about what are you interested in. So what are you passionate about? Have a look at your assignments and the practice areas that you've enjoyed as a student. What do you enjoy reading about? And I know as first and second years, you're so busy with assignments. Sometimes, just spending a day in the library, going and having a look at all of these areas and look at current journals and topics to get some ideas is really helpful. You might choose a patient or client, if you prefer that term, as a specialist area of care like diabetes care or falls management, or could be to do with clinical governance or safety, or a specific condition and the management and the holistic care or the support of carers in that situation. It could be to do with nurse education, supervision or support. It could be to do with health education or promotion, or a nursing issue that you're really interested, such as digital health or currently sustainability or environmental issues. So have a read around those topic areas. And I know some students think it's got to be to do with a patient condition or management, but having a look at your university guidance, often it is to do with your profession or your role, and it can be quite broad, so you can think about all of those different topic areas that interest you. So when you're looking at the topic, ask yourself, is it interesting to me? Why is it important or significant to nursing or my current future role? And you'll be putting a rationale and purpose for your study in your introduction of your dissertation. So you need to think about, why is it important? Why am I choosing this topic area? What do I want to know? How can it influence practice in the future or inform future practice? And can you find an answer, provide an answer from the literature? Is the data manageable? Is there enough literature out there? And that's where you can gain advice from your dissertation supervisor. It must not be a topic where there is a specific yes or no answer. So, for example, does the use of prophylactic anticonvulsants following brain surgery reduce the risk of post-operative seizures? Well, the answer to that is yes, and there is already a large, significant, definitive evidence base that already answers that question. So it's standard practice to administer and to prescribe anticonvulsants when patients have brain surgery. So the topic, the review or the research question should not be too specific with a closed yes/no answer, or be answered with a simple statement. Adhering to university guidance is very important, and always ask your dissertation module lead or your supervisor if you're unsure, and they should help you focus your ideas and your topic areas. And if you're not quite sure if a topic area is allowed, if it's a really unusual topic area, then always check with them. And the topic should relate to our nursing profession, your future practice, or influencing future practice, education, nurse research, or roles. There needs to be an evidence base, as I said, and always check the dissertation assessment criteria grid and the module handbook guidance, because it will define how many hours of supervision that you have, and you can use that supervision and by negotiating with your supervisor. And if you want to use some of that time to help you narrow your project down, your research down, your review down, the topic area, that should be fine, but always check with that module handbook guidance. You'll be moving from a broad topic area, as I mentioned earlier. If you're interested in newly registered nurse transition to registered nurse, to a specific area where you're defining the population that you are as part of your topic area and your research question, the context, the area of interest. So to do that, to move from the broad to a specific topic area, you need to read around the topic before choosing. And as I said, it can change. You might not have the same research question that you first write. It might completely change by the time you've gone through the process of reviewing literature. It's helpful to talk to experts, advanced nurse practitioners, charities or national forums, review article abstracts and make notes. You're gaining a feel for an area without going too in depth and rigorously appraising each article. From an abstract, you can find out the aim, the purpose of that study or that review, that paper, the main findings, the recommendations, and book a one-to-one with a healthcare librarian to narrow your search terms when you've started to have an idea of what your topic area is and the research question, or you've just got a topic area. if you book a one-to-one with the healthcare librarian, they can start to help you put in key terms into the database searches, and they can really help with narrowing down. Start early. I know it's really hard sometimes to get going, but if you think methodically and break it down into parts. So I said earlier, talk to specialist nurses. So you can write a list of what you need to do. You might, depending on your topic area, you might need to link to a national charity. If you were doing something on diabetes or a condition-based topic area that aligns to a charity, then that might be on your list to do. You might have specialist nurses and advanced nurse practitioners, as I mentioned earlier, and then go and look at the literature. But starting early in your second year or over the summer before you start third year, although you very much need a break over the summer as well, but it motivates you to get started if you break it down into goals, smaller goals. Assign dates in your calendar to research the topic area to get you started. And remember, the process may not be linear. It might be that you go down one area, one topic area, but you realise actually you're gaining an interest in another area. You might completely change. You might have two topics that you've got to decide on one. It might be that you start to go research and you think actually this is really, when you're looking at the papers, the seminal works, that you think that, oh, I didn't think this area is really interesting, and you go down to another path with it. And that's the whole process of you as a dissertation student, is that you have to go through that process really, and then you know, to be really happy with your topic area, and that's normal. It's okay to tweak and refine your question later as well, and you might make changes. As a PhD student, my research questions are completely different to the ones that I started, and that was from going through the literature and actually realizing what's feasible for you as a student, that you might not be, you might have to narrow down further because it's not feasible because there's so much literature in one area that you have to define it even further. What's helpful is to scope some key articles in the topic area. Look at the articles that are most heavily, widely cited and that are seminal works. If there's any literature reviews in the area that have been conducted in the past, if there's any concept analysis, is there any national reviews that have been done in this area, studies that have been done in the area, and try and have a look at the top 5 to 8 most relevant articles, not using the CASP, the critical appraisal tools, and going too in depth, just looking at the abstracts and then looking at what they say about that area of interest, and then speak to your supervisors to tweak your research question and to think, is this topic area manageable? And then you can go and look at more articles, but it'll give you a feel for an area. And as I said, review the article abstract, the introduction, the conclusion and recommendations. What issues are being raised and what are the gaps in the area? And you can discuss those with your supervisor. One thing to think about is qualitative versus quantitative research studies that you might review. And I know some students would come to me as a dissertation supervisor and say, I'm going to do a qualitative literature review, and they wouldn't necessarily have their topic area, a focus narrowed down. And that's questionable because depending on your topic and question, there may be mixed method studies, for example. There may be some quantitative research in that area. Obviously, if you're looking at nurses' experiences, patient experiences and perceptions, they are much more likely to be qualitative data. But for some topic areas, there may be mixed methods. And it was something that I found out as a PhD student, actually. I started to look at nurse-patient interactions, which I'm really interested in, and how electronic patient records influenced or impacts on those interactions at the bedside. And my assumption was there'd be a lot more qualitative data, and actually there was quite a lot of studies that used mixed methods, and interactions were measured sometimes. So the length, the duration of a nurse-patient interaction and how many took place was quantitative data. So it's interesting. So do look at go broadly, think more broadly, and you don't know for sure till you actually go and look at your literature. If you're creating a research proposal, then it may very well be that it's going to be a qualitative study and it's clearly defined. But with literature reviews, you can't always do that till you go and look at the literature to see what's out there. And as I said, you will refine your research question potentially, and it might change or be tweaked as you go along once you've started with that topic area or area of interest or problem that you want to look at. So formulating your research question, just a few tips. There are some mnemonic frameworks out there to help you define a research study or a review question, and to help you narrow down those key search terms. And your universities will probably have in your dissertation handbooks may have some references, but I've got some key references on some slides. So you've got Pico, which really reflects more of a quantitative question, though some people will use it for qualitative and adapt it. So it could be the effectiveness of a treatment, comparing risks or prognostic factors, which you might be doing as part of your study. You've got Pico, which was an adaptation of the initial Pico for qualitative question, exploring experiences, beliefs, opinions, attitudes or perceptions. And there's also Spider, which is an alternative search strategy tool to Pico, and it allows you to search for 3 types of research. And you don't worry if you're not quite sure how to use these mnemonic frameworks. Get some advice from your supervisors, and you might want to adapt them, and you might just say in your dissertation that it reflects one of these frameworks and just have a reference in there, but they are helpful to use. So with Pico, if you want a reference, Richardson et al. It was first introduced by Richardson et al. And it's been there are other papers and slight adaptations. The tool was originally introduced to break down clinical questions into searchable keywords. So the P is for patient, problem or population, age, disease, setting. The I is for intervention or exposure of interest, which could be increased, decreased occurrence of disease or healthcare outcomes, pollution, diet or lifestyle, for example. Comparison, C, for comparison or control. So you might compare an intervention or a risk. So here, this is where the quantitative, it aligns very much to a quantitative data. And outcome, O for outcome, which might be death, pain, fatigue, symptoms or disease, the disease of interest. Outcomes linked to the disease of interest. So an example question, I just wrote this last night. How does the deployment of digital decision tools impact on the clinical outcomes of inpatients in UK hospitals? So if I have a look now at how it aligns to Pico. So P for patient, problem or population. So we're looking at inpatients in UK hospitals. I for intervention, the exposure of interest is the deployment of digital decision tools. The comparison, I suppose, is how they impact on the clinical outcomes. And then the outcomes would be the clinical outcomes, which would be looked at, which might be linked to fatigue or pain or symptoms. So that's sort of how I used the Pico to create that question as an example. So Pico with a small o for qualitative questions, P for population or problem, what's the problem, population under investigation or as a focus for your review. I for interest may relate to an activity, an event, a process or an experience. And CO for context, so what's the setting or characteristics. So again, I wrote this question last night. What are the experiences of UK student nurses in placement during a COVID-19 pandemic? And what was interesting was I put what are the experiences of UK nurses, and then by using the Pico I thought actually I need to have the population narrowed down and put student nurses or registered nurses, for example, or ICU nurses. So this is the way that you use these mnemonics to help refine your question and your area of interest. So I hope you find it helpful with some example questions. And as I said, it takes time to tweak them. You could spend a few weeks going through the literature and changing slightly the focus for those questions, and obviously use your supervisors as well. So the Pico tools are the most popular that are used by students, but there's also Spider, designed by Cook, Smith and Booth, and they designed the tool following difficulties using Pico when searching for qualitative and mixed method research. So it's an alternative, and I'll just go through the mnemonic on the next slide. So S for sample, maybe smaller groups in qualitative research, and so they felt that the sample needed to be in there. PI for phenomenon of interest, to understand the how and why of certain behaviours, decisions or experiences. D for design, and that's instead of the comparison on Pico, the theoretical framework used determines the research method used. E, so evaluation is important in qualitative research, the attitudes and views as the outcome measures, for example. And then R for research type, so the 3 types of research can be searched for using this tool. So the references are there if you do need them for your dissertations. And then I've just got some example research questions here, and some of them are not brilliant, but they could be tweaked. But just to give you some examples where I've used the Pico to design some of these questions. So what are the experiences of registered nurses using electronic patient records in UK hospitals? Another example, what are the experiences of newly registered nurses in UK hospitals during their first year registered? What are patients' perceptions of nurses' uniforms in UK hospitals and community settings? And I just thought, I'm quite interested to know what patients think about uniforms. I have no idea if there is any research out there and what it's if patients' perceptions have been sought in research. There may be nothing out there, but I just thought it's quite an interesting topic. How does nurses' use of EPR affect the quality of nurse-patient interactions in hospital settings? That's one of my research questions in my PhD. Sometimes you might have 2 questions, and this one probably will need quite a bit of tweaking, but I thought it would be really interesting to look at what sustainable healthcare initiatives have been implemented and evaluated across the UK. I'd love to know, to have a look at the literature and have a look at the initiatives out there and the evaluations and what the literature says. And a second question, what impact did these UK sustainable healthcare initiatives have? So I did those questions very quickly, but this is where you'd start by writing some questions and then they can be tweaked and changed later. So as I said, they're not perfect. Example questions. So what effect do therapy pets have on people in nursing homes? And how does the use of dance affect the healthcare outcomes of patients with Parkinson's disease, for example? How effective are UK preceptorship programmes in meeting the needs of newly registered nurses? I think there's quite a lot of work being done nationally on that area currently. What are the experiences of UK students in placement during a COVID-19 pandemic? What factors contribute to the retention of nurses? So some questions to do with symptom management. What are the effects of massage therapy on the symptom management of people with multiple sclerosis? How effective are NHS wellbeing support programmes to meet the needs of UK registered nurses? And wellbeing, this is something I'm interested in, and wellbeing support programmes are being utilised, especially through the pandemic and following the issues that we've had with nurses leaving our profession due to stress. How are spinal care practitioner roles being utilised and contributing to healthcare across the UK? Or it could be nurse consultant roles, for example. How effective is the role of, and so it gives you just some examples of some questions and some topic areas. So I hope you found this talk helpful. Do subscribe to my channel if you want any more free videos that you think might help your career development. You can follow me on Twitter or Instagram, and I have a website. Do ask any questions in the comments on YouTube as well. Finally, good luck with those dissertations, and I wish you every success in your final year and in your future career.